Nosy Neighbors fans, it is Jessica Carden with Murdoch Manwaring Company, a real estate group at Keller Williams Realty East Idaho, your nosy neighbors. Thanks for joining us today. Today we're here in Idaho Falls on a beautiful, maybe spring, maybe fall spring day, and we are at 2001 South Woodruff in the Teton Medical Specialty Center because we are visiting today with Senior Health Group. It's got some really neat products and really neat things available for people that are looking, well, there's a lot of misconceptions about things that, especially for seniors, on health and insurance and a few things. So we're going to talk about that today. We're talking with the owner, Olin, and we're going to just find out all this information that really is beneficial to a lot of our seniors here locally. So thanks for joining us. And by the way, if you love local businesses like we do, please like and follow the Nosy Neighbors page right here. Go back and check out all of these amazing local businesses and local people. And if you love real estate, head over to Murdoch Manwaring Company and check out the local stats that we just put out every month about the real estate market. Things are crazy, and we would love to help you if you need to sell or buy a home. Okay, let's get in here. Let's take a look at and talk to Olin, and let's talk about what's available for our seniors here in our area. You'll notice we're coming around. We are around the back of the plaza. Come in door C. It's the easiest way to get there. So as you walk in, you'll see this other door. That faces Woodruff. So if you did come in the front, it's okay, but door C is an easy shot right to Suite 19. So you can see here, it's easy to find them. They got a great little mat. Suite 19, Olin Barkdale. Let's go in and talk to him. Well, hello, Mr. Barkdale. We're the Nosy Neighbors. Can we ask some questions about Senior Health Group?
Absolutely.
Fantastic. So tell us who you are.
Okay, we've been in business since 1983, and we've been at this location for about 8 years now. We offer all kinds of Medicare coverage and life insurance and financial services, but our main niche is the Medicare market. And so a lot of people who are turning 65 or perhaps are disabled, they're on Medicare. They need to know what coverages are available to them, how to get the best one for their situation, and we walk them through that. A lot of times we'll get a call from someone who is looking to retire. They don't know for sure what they need to do, so we walk them through that. I had one gentleman in here today that he wants to continue working for a while, so doesn't need to do anything.
Gotcha.
But
he's just kind of getting ready.
Exactly, but his
Makes
wife
sense.
is looking to retire in a few months. So we'll be able to walk her through the steps necessary to get her Medicare card.
Well, that's awesome. Yeah. So can anybody, so the customer that would come in to visit you, it's anybody?
Anybody.
Anybody who has questions can walk in off the door?
Absolutely. No obligation. We just want to educate and help everyone who has questions about Medicare, particularly aged parents. The children are worried, do they have the right coverage? Maybe they're moving new into the area. What can they get for their parents? They have questions. We love to have them come in and we'll help them out. And
perfect. Yeah. So if someone needs help, how do they make an appointment, or can they just walk in the door?
They can walk in the door. We have a licensed agent here. My son and I are here. At least one of us is here. I'm here all the time unless I'm not here. But
and what are your hours?
9 o'clock until 5.
Okay.
But we also operate on appointment because we have a number of people who are looking to retire, but they're still working.
Makes sense.
And so we'll meet with them in the evening, and we'll also meet with them on Saturdays that works better.
So do they call in? Do they email? Do they go online? How do they make an appointment if they don't just walk in?
They can call our office, and I know that we're on the internet, but I'm not quite sure of all the internet situations, but they can walk in. We do a class called Medicare 101, and a lot of people will pick up our information sheets, give us a call, we make an appointment, and at their convenience, but we do have a lot of walk-ins as well.
Fantastic.
A lot of referrals. So
to send you over that way. So yeah. You say you've offered some products. What kind of products are you offering?
So with the Medicare coverages, of course, we have the Medicare supplements, which everybody is aware of, and then we have Medicare Advantage, which came about 16 years ago, and then the drug plans that tie in with that. Then, of course, we offer life insurance products and annuities, also the financial planning. I'm a certified financial planner, so
wow.
I can help people who are looking to retire and they want to be able to maybe boost up that savings account a little bit,
Makes sense.
I can help them on that.
Well, how about we head this way and maybe give us a little
That'd
tour
be great.
behind the special door?
Absolutely.
Let's look. Really great little comfortable little waiting room here. Now, I see a lot of jokes around here. It does seem like you guys aren't too serious.
Little bit of humor.
I love that.
We get smiles from our clients.
That's fantastic.
And the rules of chocolate are wonderful.
I was noticing that.
So
I'm like, that's fantastic.
We have our clients come in. We say, you always can get a cold Pepsi and chocolate. So
that's my kind of place.
Yeah, come on
Fantastic.
back.
So if they make an appointment, are they going to meet with you, Olin?
They'll either meet with me or with Dan.
Okay, perfect.
One of the two.
Are you guys specialized, or can you both do all things?
We both do the same thing, except I do the financial planning part on that, and because I am a CFP, so it works out real well. Yeah.
So let's, I'm sitting here as a customer. I think about, okay, so if I'm coming to the age of Medicare, but are there any other things that makes me think of, health-related things, other products, anything else that we should know that you do beyond Medicare?
So we do dental insurance.
Oh.
And we also do the cancer policies, catastrophic policies for people who, especially with kids. Kids are very active, they get hurt in sports. We do offer accident policies. Mostly we find that on your group coverage or individual coverage have large deductibles,
right.
$2,000 or $3,000. Well, you have someone on a child on a baseball team or playing hockey or something, they break a leg or sprain a foot or something, easily hundreds of dollars, if not $1,000 or $2,000, and the accident policy would help towards that deductible.
Oh, that's really neat. What kind of policy do you get for a dental policy? So the accident policy is for anybody. It doesn't have to be a 65 or older. It's anyone.
Exactly, and the dental policy is for all ages as well. We do offer it to our seniors because a lot of them, as they're retiring, they no longer have dental coverage.
Right.
And we've found that statistics say that if you have good dental health, your heart is going to be healthy.
I've heard that.
And so we offer that, and what's nice about it is you may not need dental right now, but you go in to see your dentist in a month or two, they do that exam, and dentists are good. I love my dentist, by the way, but they find something, which they're paid to do that, and so all of a sudden you find you may have a $300 or $400 or $500 dental bill looking at you. I actually have dental coverage that I can put in effect for you tomorrow.
Wow.
And it'll pay 60% on your preventative and basic. Major stuff, it will not cover until 9 months has passed. Oh. A lot of people, they want the dental coverage when they find out they need a crown or a root canal. And so there's no plan out there that will cover you unless there's a 9 or 12 month waiting period. My dental plan that I really like, I found this about 3 years ago, is a 9 month waiting period. Most of the others out there are 12-month waiting period.
Oh, gotcha. So kind of a different...
So 9 months is a lot faster than 12.
Yes.
And especially when you need to have a bad tooth taken care of or a new crown, that type of thing. So,
how much does that kind of run a month?
If
you're trying to think of what you would be...
So people in their 20s, you're looking at $22 a month starting. For people that are my age, on Medicare and stuff, you're looking at around $35 to $40 a month.
That's not bad. It's not like health insurance that's $8 or $9 a month.
And the nice thing about it is you get more than just dental insurance. You also have vision and hearing.
Wow.
So for those of us who are starting to get a little silver-haired, we have some hearing issues or vision problems, you do have coverage on that. It is limited to $200 or $500 on your vision and hearing, but it goes hand in hand with the dental. So it makes it a whole package. You don't have to sit there and buy 2 or 3 packages. You got it all in one.
That makes sense.
And it works out really well.
That's very cool.
And the network, there's 2 ways. You can go through the network, which will save you some money, or you can just, the policy is an indemnity policy, and it'll pay your dentist as well. So it really works well around here.
That's nice.
And I found
I didn't know about all that stuff.
All the dentists have the networks. They got a lot of networks, and they all belong to it, but it works really well.
I imagine. So we've got dental, and on top of that, you also do financial planning, and so that's for anyone. What kind of benefits do they have if they are looking at tying that all together with financial planning?
Also, with the financial planning, what they're looking at is trying to figure out, okay, for instance, right now we have markets that we we do not know what's going to happen with the financial market. You know, with the what's going on right now currently in the world. What we know is that the market is either going to go up 20% or it's going to go down 20%. We just don't know when, but we do know that the next 100% is going to be up. And so what I do is I coach people through their financial planning and retirement planning, and they got to be in the market. We are a consumer nation, but we believe in capitalism. Capitalism is the greatest wealth creation in the world. Always has been, always will be. That's why we're so great as a nation. Everyone's coming to the United States. I never see on the news where someone's jumping a boat from Florida going to Cuba. Doesn't happen. They're coming here. So I can help them with that, and with the Nobel Prize winning principles that my financial firm uses, they're on sound ground. They don't have to worry about, what's the market going to do. They don't have to worry. It's peace of mind with a true purpose in life. They know what they want. My true purpose in life is love. I want to be able to have the wealth that I can do more things for my family. Other people have different purposes in life. True purpose might be peace, family, those types of things. But we coach them through that and help them to identify what their true purpose in life is.
What if they don't know anything about it? Can they just come in and ask questions and get an idea of where, and
many do. Many of them do.
Excellent.
And they're not sure exactly what questions to ask, so we kind of guide them through. I do have a book that I give them, and it talks about the market, the things that you need to be aware of. And I said, before we do anything else, take this book, and if you can, read the whole book. But if you can't do that, at least read chapter 2. Because I won't go any further with them on the financial planning or stuff until they have some basics down.
Oh, that's helpful.
Because a lot of us aren't aware of how the stock market works or Wall Street, and we hear all kinds of different things.
Yeah.
I help guide people through that and take away the fears. The market's great. I love the market. In fact, my happiest days are when the market's going down. And I get into that. They'll say, what? Why is that? And I go, I'll tell you. When you're ready, I'll tell you.
And for someone who is growing wealth, there's those things that you don't know. And say, this is why having someone help you and guide you is the key.
Exactly.
That makes sense.
And so I ask people, number one, do you have a budget? And they go, well, kind of. And I says, that's the biggest problem a lot of people have, is they don't know where their money's going. So you need to get that budget set up. And then, are you contributing to your employer's retirement plan, 401k? Well, kind of, not really. You just need to pay yourself first. And that's what's important. And
sometimes it just takes someone kind of giving you those structures. Everyone feels like they kind of know a little bit, but then you don't have a plan and you don't have it implemented. So that's super helpful to have a resource. So in this, when we look at Medicare, because that's your other big product, right? When do they start? When should they come in and visit with you about Medicare? When's that time to begin?
So they start at age 65. So if a person is born, let's say in the month of June, and it would be any day from June 2nd through the 30th, because June doesn't have 31 days. But they would start on June 1st. Now Medicare has a real neat rule. If anyone who is born on the 1st of the month, their Medicare takes effect the month prior. So if your birthday was June 1st, well then you become eligible for Medicare May 1st. And I don't know why it's there, but that's something in the Medicare rules. So as they're coming in, normally we like to meet with people 2 to 3 months prior to them turning 65. Sometimes we'll have them in here 6 months to a year, and that's great. We prefer that, because then we're going to give them some timelines and some guidance on where they want to be at particular moments prior to them turning 65. And
so maybe on your 64th birthday is the time to start to begin.
Exactly. Or 63rd. Very few couples have the same ages. Typically around here you'll find that one spouse is a year or 2 years older than the other. And so there's questions on, well, I've got coverage now through my employer, but my wife is a year younger than me, and if I retire, she loses coverage.
Makes sense.
Well, then you have to pick up individual coverage, which may be expensive. Maybe a person might want to work an extra year. We don't know. So
that's a good thought.
we tackle all these things, and you don't know the answer. So then we have homework. I'm good at homework to find out, well, what is best for you? Because I can't determine that, but I'm going to give you some ideas on what to go looking for and then be able to pick the best course for you.
Well, it sounds like your birthday is a good date to remind you to do things.
Yep.
Is there anything else going on our birthdays that we should know about?
Well, there is a new rule from the state legislature last year passed what's called the birthday rule. And so
Does that mean I get to take my birthday off as a federal holiday?
Well, you would think, but no, you still have to celebrate it. And the birthday rule is for those who have Medicare supplements, not Medicare Advantage, not the Part C, but Medicare supplements, which covers A and B, your hospital and your medical. They have the opportunity to change to a different carrier with no underwriting. Doesn't matter what their health is. So they can have cancer or bad heart issues, diabetes, whatever. Normally, up till March 1st, nobody would take these these Medicare beneficiaries because their health wasn't that good.
Right.
Now they can.
Wow.
And Idaho has switched from an age-rated premium-based for their Medicare supplements to community rating.
Wow.
So it doesn't matter if you're 65 or 95, you pay the same rate.
Wow.
So for a 95-year-old, wonderful news. For me, where I just went on Medicare, maybe not so great, but that's okay. It all works out.
Yeah.
And I think it's the best thing that the state has done. There are a few other states that have done it, but not very many. And so Idaho is way ahead of the curve here.
So that gets implemented on their birthday this year? Do they need to then probably call now to find out more information about it?
Exactly. So a couple months before their birthday, they need to come in so we can check their current rates, see how they compare. A number of my clients, their rates are only $1 or $2 different than the community rate. So we're not going to do anything right now. But I think there's going to be some changes here this next year as insurance companies find out what their claim ratio is. There'll be some changes in that. And so what's nice is every birthday you get to look at this and decide if you want to change or not.
So that implements from now on.
Does,
every birthday you have a free pass.
Exactly.
Wow.
And so we can't do anything until we can't submit the enrollment until it's your birthday.
Right.
So the effective date is always the first of the month following. But at least you kind of have an idea of, oh, this is going to save me some money. A lot of our folks that are in their 80s and stuff, a lot of them, surprisingly, are paying $300 a month, $350 a month for their what's called Plan F. That was the Cadillac plan that my parents had, probably your parents, Plan F. 100%. With this community rating, they can go from this 300 or 350 down to 220. Huge.
Yeah.
For a retired person, seniors that are living on fixed income, to be able to save $90 or $100 a month.
Yeah, huge.
And maybe if they're a couple, twice, $200, that's a lot of money.
Yeah.
And so.
Wow.
So
sounds like people need to get in here.
They do.
And find out the information, especially if they don't know.
And the biggest thing that we do with everyone that I find that it is not done all the time, but we do it, we practice what's called the 3Ds. And those are doctors. It doesn't do any good for us to put you on a plan that you can't go see your doctor.
Right.
So we make sure that the plans we put you on, the supplements are not an issue. Medicare Advantage plans have networks. You want the doctors to be in the network.
Yeah.
The second part is drugs, prescriptions. And people have a wide assortment. One wife will have a different set of prescriptions than what her husband has, and so they may have different policies based on the formulary or covered prescriptions. And so we go through that. We want to cover the doctors, we want to cover the drugs, make sure that they're all covered. And then the third part is dollars. We want to make sure that the dollars are going to save you money. It's not going to do any good to put you on a plan that's going to cost you more than what you're currently paying. Yeah. I happened to do a plan here for a lady that looked like the cheap drug plan would be best for her. And then looking at it further with her formulary of drugs, the one that was about $60 a month more is better because it covers her prescriptions, and her out-of-pocket differed from, instead of about $120 a month, it got it down to about $80 a month.
Wow.
So we kind of look at, as consumers, we always look at the lowest price. That must be best.
Right.
Not the case. That's why we go through this and compare and make sure it's best. And then the plan I put you on for right now, it will change for next year. Almost guaranteed. So we got to review it.
Because you got to review it every year to make sure
year.
there's all, because everything changes.
Absolutely.
That makes it very hard if you don't have someone, especially local, that you can come talk to. There gets to be a point where this can be overwhelming.
Exactly.
And there might be misinformation, and you're not, so having a local resource is really beneficial.
And we get a number of folks who have other agents that, their agents are out of the area. They just don't know who to go to. They come into our office, and that's fine. We love to have them here, mainly just to make sure that they're on a good plan. They're getting the best bang for their dollar.
Yeah.
And it's important.
Yeah.
When you're on a fixed income, you've got to watch those dollars.
Yeah. And you got to be on top of it. And that's hard sometimes because it feels like that's something you don't want to have to manage all the time. So having somebody that's helping you and that you trust is a big, important part.
In fact, going back to people who are looking for something, we do what's called Medicare 101. And we have dates on that all year long, to where generally it's either we were doing them on Thursdays and Wednesdays, and we found out we were interfering with bowling dates or something.
Heaven forbid.
And so we went to Fridays, because most people are off on Fridays, especially out at the site. And so we offer classes at 3 o'clock and 6 o'clock on the first Fridays of every month, and cover Medicare 101. What are your co-payments going to be? Are your doctors going to be in the network? One of the biggest ones is deadlines. If you miss the Part B deadline, it's a 10% penalty that will follow you for the rest of your life.
Wow.
So right now, if you can look at this chart, we're looking at the Medicare donut hole. This is on prescriptions, but the Part B premium this year is $170.10. If you miss the Part B deadline, that's going to cost you 10% or $17 a month more above the 170 for the rest of your life.
Oh my goodness.
And that went from 148 last year to 170, and they're projecting that this is going to be at 250 before the next 3 or 4 years passes by. It continues to go up.
Wow.
The other
that makes it important.
Yeah, the other thing is when you're looking at the donut hole, a lot of people say, well, how much are my drugs going to cost me? Well, you have a $480 deductible for this year, which most plans charge that. And then after that, your co-pays are going to be $0 or maybe $1 or $3. So the drug company is going to be picking up about 75% of the share of the cost, and you, the consumer, would be about 25%, up till $44.30 this year. Then you go into what's called the donut hole. And a lot of people think that once they've spent $4,400, they're now covered in catastrophic. They're not. You do have to spend this year $7,050 in order to get the catastrophic. And that point, you're at $985 or $395. And these change every year.
Wow.
That's why it's important to review them.
To review it and go over it.
Yep.
Wow.
An annual election period is during hunting season.
Of course it is. Because we're going to try to make sure that it goes in and out. Well, this is fantastic.
Yeah.
Fantastic. It seems like really what's important is coming in and being informed.
Exactly.
And making sure you have a trusted resource so that you can ask these questions and keep up on things that change so you don't end up paying more.
Yep.
That's awesome.
And I do have a number of clients who aren't able to make it out of their homes, and we do make house calls.
Oh, wonderful.
But we prefer to do it here because number one, we got our computer set up, all of our materials here. It makes it very easy.
That's awesome.
And we found most people go to the doctor anyway, so they don't mind coming here.
Coming in for a little trip. Well, that's awesome. Well, Olin, thank you so much. Again,
You bet.
If they want to make an appointment, what number do they call?
208-980-7217.
Perfect.
It looks like a cell phone number, but it isn't.
It is not. So don't text it.
No.
That gets you right
well,
here.
Actually, you can text, but
Ah!
I just haven't figured out how to get the messages off.
So best just to give you a call.
Exactly, and we'd be glad
fantastic.
to meet with them, and they can stop by.
Or stop on by. Awesome. Well, thank you. Again, you guys, we're here, right? It's so easy, right on Woodruff, in an easy location. Come around back, come to the door, see, and then come right down the hall, and you'll see it really easy. Right here at Senior Health Group. Olin Barchel and his son, who's avoiding the camera, we'll meet him. And come take a look. Again, this has been Jessica Carden with Murdoch Man-Wearing Company, your nosy neighbors, keeping you in the know.
The Nosy Neighbors, keeping you in the know.
The Nosy Neighbors, keeping you in the know.
Nosy Neighbors, keeping you in the know.
The Nosy Neighbors, keeping you in the know.
Nosy Neighbors, keeping you in the know.
So the Nosy Neighbors keeping you in the know.
The Nosy Neighbors are going to keep you in the know.